Hello guys, how you all doing? If you are seeing my face for the first time, my name is Adiola and this is your Health Gist with Adiola. And in today's topic, we are going to be talking about peptic ulcer disease. So what is peptic ulcer disease? What are the causes, the risk factor, the signs and symptoms, the test and diagnosis, the the food that you can eat to prevent or to manage the peptic ulcer disease. So let's if you find today's topic interesting, please join me and let's dive right into this video. What is peptic ulcer? Peptic ulcer disease means a sore or wound that develop on the lining of the esophagus, stomach, or small intestine. Ulcer occur when stomach acid damage the lining of the digestive tract. So what is a risk factor? People that are at the risk of having it. Smokers. Smoking may increase the risk of peptic ulcer in people who infected with H. pylori. Alcohol. Drinking of alcohol can irritate and erode the mucous lining of the stomach. People that fast a lot and also people that do not eat on time can also be prone or liable to have peptic ulcer disease. So common causes include H. pylori, a bacterium called Helicobacter pylori. Bacteria usually pass from person to person through direct contact with saliva, vomit, or stool. H. pylori may also spread through contaminated food or water, unwashed fruits like berries, grapes, apples, undercooked or raw meat and poultry. Regular use of certain pain reliever, long-term use of non-antisteroidal anti-inflammatory drugs e.g. ibuprofen and aspirin. Dwelling on these drugs can also cause ulcer. Smoking and drinking alcohol can also cause ulcer. Medication that can only that can lead to ulcer is medication of osteoarthritis. It can also lead to ulcer. Then what are the symptoms? Burning pain is the most common symptoms of peptic ulcer. The pain is caused by ulcer and aggravated by stomach acid coming in contact with ulcerated area. The pain typically may be felt anywhere from your navel up to your breastbone. Be worsen when your stomach is empty, flare at night, often be temporarily relieved by eating certain food that buffer stomach acid or by taking an acid reducing substance, disappear and then return for a few days or weeks. Other signs and symptoms: vomiting of blood which may appear red or black, dark blood in stool or stool that are black or tarry, nausea and vomiting, unexplained weight loss and appetite changes. So those are the causes and the symptoms. Then abdominal discomfort, feeling full too soon while eating a meal, bloating, belching and changing in color of stool. So those are the symptoms. So let's go into complication. Left untreated, peptic ulcer results in internal bleeding. Bleeding can occur as slow blood loss that leads to anemia or a severe blood loss that may require hospitalization or blood transfusion. Severe blood loss may cause black or bloody vomit or black or bloody stool. Infection. Peptic ulcer can hit a hole through the walls of your stomach or small intestine, putting you at risk of serious infection of your abdominal cavity, which is called peritonitis. Scar tissue. Peptic ulcer can also produce scar tissue that can block the passage of food through the digestive tract, causing you to become full easily, to vomit and to lose weight. So what are the tests and diagnosis? Doctor may recommend tests to determine whether the bacterium H. pylori is present by using blood, breath, stool for aqueous blood, using a scope to examine the upper digestive system, which is endoscopy, and for x-ray of your upper digestive system, also called barium swallow or upper gastrointestinal series. So those are the tests for H. pylori for peptic ulcer disease. What are the treatments? Antibiotics, medication to kill the H. pylori if H. pylori is found in your digestive tract, combination of antibiotics to kill the bacteria as well as additional medication to reduce stomach acid. Medication that block acid production and promote healing, proton pump inhibitors reduce stomach acid by blocking the action of part of the cell that produce acid. Medication include omeprazole. Medication to reduce acid production, acid blockers, also called histamine blockers, reduce the amount of stomach acid releasing into the digestive tract, which relieve peptic pain and encourage healing. Medication include ranitidine, cimetidine, nizatidine. Also, antacid that neutralize stomach acid. Antacid neutralize existing stomach acid and can provide rapid pain relief. Antacid can provide symptoms relief but generally are not used to heal the ulcer. Medication that protect the lining of your stomach and small intestine is mistoprostol. So those are the medication. It is very important to also see your doctor. Then food and drink to avoid as an ulcer patient. We have alcohol, caffeine and soda, coffee and soda, tomato and tomato products, lemon and other citrus fruits like um orange and pineapple, fried or fatty acid, chips, popcorn, hot pepper and other spicy food, chocolate in some people. Best food for an ulcer patient: fibre rich food like apple, pear, oatmeal and other food that are high in fibre are good for ulcer. Fibre can lower the amount of acid in the stomach while easing bloating and pain. Other Also take your drugs as prescribed by the doctor and avoid drugs over the counter and chemist, and also eat on time and don't fast when you are having all these symptoms, and also see your doctor for further test. Lean meat, olive oil, whole grains, fruits like apple, pear, banana, watermelon and honey are also good for ulcer patients. So also consult your doctor and explain so that they will know what next to do. If you find today's topic interesting, please like, subscribe and share. Till I see you in my next video. Bye and God bless.